All right, so our next one is Estim. So we're still in that 1 to 3 day time frame. So we're still in that acute inflammatory. So we're trying to decrease temperature, slow reaction overload to the nerve endings, kind of reduce the pain and stuff. So let's get into it. So its purpose is to control pain. It can also help exercise muscle tissue to decrease atrophy. So that's that wasting away of muscles. It can encourage some circulation, increase tissue temperature, encourage breakdown of adhesions. We can start re-educating those muscles. When things get damaged, we got to re-educate stuff. So we have two types. So we have neuromuscular electrical stimulation, or NMES, and then our TENS units, or transcutaneous electrical nerve stimulations. And a lot of you probably have some of these at your house, this bottom one. And then I have one of these in the training room. So what the top one is for is to contract muscles by stimulating the motor nerves. So we're able to contract that muscle. And then the bottom one, it helps reduce pain by sensory nerves and pain receptors in your muscles. Okay. So some of our contraindications, if somebody has a pacemaker, you don't want to put electrotherapy on them because it can mess that up if they're pregnant. When you don't want a muscle contraction, so if we have somebody that has like an avulsion fracture, we're definitely not wanting to do that on them. Again, fractures, if there's active bleeding, because if you think about it, if we're stimulating the muscle and there's a bleeding spot, we're just going to stimulate that, and we don't want that. Malignancies like cancer stuff, we don't want as well. So what Estim does, so it's going to increase range of motion, can help increase muscle strength, re-educates the muscles, decrease our pain, spasms. Okay, those small ones, those 10 units, can help with pain. So we always use electrodes. We put it on the muscles that we want. The closer the pads are, the shallower it is, so which means that the farther apart they are, the deeper we can get. We can exercise when we're using them. And we can also combine them with ice packs, that cold water. We could even use ultrasound, which we'll get to later.